Hi, everybody. Dr. Julie McLaughlin here from Begin with Wellness. Today, we are going to talk about unlocking the sunshine vitamin. We're going to take a deep dive into vitamin D. Let's get started. I have a PowerPoint to share with you. So vitamin D is actually a hormone precursor. They call it 25-hydroxy vitamin D, and it promotes bone health, calcium, and phosphorus metabolism, among quite a few other things that you're going to see. So we have symptoms if we have a vitamin D deficiency. A lot of people don't think that you're going to get a symptom from a vitamin D deficiency, but you do. Back pain, if you catch yourself holding your breath a lot, burns, you burn easily, cancers, colds, congestive heart failure, cardiovascular disease, diabetes, fatigue, hearing loss, insulin resistance, influenza, cold and flus, myopathy, like muscle aches and pains, osteomalacia, osteoporosis, Paget's disease, which is a type of cancer, PCOS, SAD, thyroid problems, and rickets. Now you're like, what the heck? I didn't know that vitamin D deficiency could contribute to all these conditions, and is definitely linked. During the COVID era, they've done so much research. Now, I've been testing vitamin D on my patients for 20 years, but so much more has come to light since COVID because of the great benefits that we get from vitamin D. So why do we love vitamin D so much? It's a fat-soluble vitamin, but it's an immune booster and an energy booster. It helps with calcium absorption for stronger bones, and it helps with weight loss and blood pressure regulation, mood regulation, cognitive function, and it plays a role in reducing inflammation and cancer prevention and cancer metastasis. That's a lot one little vitamin does. Now, where do we get it from? Well, we can get it from synthesizing it from the sun. But let's face it, those UVB rays, we're not getting that many of them. We're all wearing clothes, hopefully, right? Hopefully we're wearing clothes, or we're wearing sunscreen, or we're indoors. So we're not getting enough. Even people who are outdoors all the time tend to still be deficient with our ozone and the way our atmosphere is. So you can also get it from your diet, from fatty fish and fortified foods and mushrooms, but you would have to eat a lot of it. And so we don't always eat a lot of fatty fish because we know that fish can contain mercury and you're not eating it all the time. So your best bet is to get it from supplements. Now, vitamin D is the only thing I can say 100%. I can tell you in my practice, 100% of people I test. Now, remember, I'm up between Chicago and Milwaukee. That's where I am. And 100% of my patients who are not supplementing are deficient in vitamin D. So the studies show that 25 to 57% of adults have vitamin D deficiencies that are outside the pathological range. So when you look at your lab test, the range sometimes will say anywhere between 20 to 150. Some will say 30 to 100. They're all a little bit different, but the widest range is 20 to 150. Now, me as a functional medicine doc, I like you to be between 60 and 80. Prior to COVID, the top cutoff was 100. Now they've raised that up to 150. So I want you to make sure that your vitamin D doses are high enough. And the only way to know really is to get a blood test before you start taking it. And as you are taking it, to make sure you're getting the right dose, because it varies by individual. I'm going to tell you how to dose it, but everybody has their own genetic predisposition to how they absorb vitamin D. Darker skinned people need a higher sustained dose. Larger people who have more body mass and more fat mass, they need a higher dose because it's a fat-soluble vitamin and it sequesters into the fat, right? So we want to make sure that we know. And you don't want to take too much. Taking too much vitamin D can cause kidney stones. So we don't want to go down that road either. So what are some of the causes of these deficiencies? Lack of sun exposure. We talked about that. Darker skin, increased body mass. Certain medications can deplete vitamin D as well. The older we get, the more difficult it is for us to absorb vitamin D, and overall malabsorption. If you are buying your supplements from the grocery store or from the big box store, most likely the quality is not good. I can't tell you how many people I have tested. They're like, I'm taking vitamin D, and I test their labs and they're still deficient because they're not getting absorbed. So they're not taking the right form or the right dose, or they're taking things with like corn in it and soy. So we don't want to take those type of things. So I have some recommendations on vitamin D for you that you'll be able to take. Now there's interactions with vitamin D with other nutrients like calcium, right? So calcium is essential for bone mineralization, and it helps increase the absorption of that calcium to build stronger bones. And it also helps in regulation of the parathyroid in conjunction with vitamin D. Now, if you watched my last webinar, you know you shouldn't be having more than 500 milligrams of calcium per day, including what you get in your food. So I don't want you taking extra calcium because it causes hardening of the arteries. But I want you to take that vitamin D and know that it will interact with the calcium you're getting through your diet to help build up those bones. K2 is another nutrient that's going to increase your vitamin D absorption and help with calcium absorption. So we want to know that that K2 takes that calcium and gets it to where you need it the most, rather than letting it sit in your blood vessels and kind of build up as plaque. Now, magnesium is a great natural muscle relaxer, but vitamin D can increase the gastrointestinal absorption of magnesium, and it increases the transport of magnesium from the outside your cells to inside your cells. So vitamin D is super helpful with these other nutrients as well. Now, let's talk about dosing. This can be so confusing. You go to the store and you have 1,000, 2,000, 5,000, 10,000, 50,000 once a week. You're like, which one do I take? I don't know. First of all, I want you to know your levels. Know what your levels are, right? Then, if you take 1,000 IUs daily, it will increase your vitamin D 10 nanograms per deciliter in 3 months. So let's say you started out at 20 on your vitamin D levels, and you took 1,000 milligrams or IUs a day for 3 months. You should go up to 30, right? But it's based on your weight. So you take 35 IUs of vitamin D per pound of person's weight per day. So let's look at the calculation, because it can be a little confusing. You have a 150-pound person times 35 IUs. They should be taking about 5,000 IUs of vitamin D a day. In 3 months, their vitamin D should increase by 50. Now, it does settle out. So let's say that person continues to take that 5,000. Their numbers don't always just go up, 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 up. They kind of settle out at their sweet spot between 60 and 80. But some people do increase, and you might need to decrease your dose. So you want to make sure you get a blood test prior to taking the vitamin D and after taking it for a specific amount of time, specifically 3 months, so you know how you absorb it. Every single person's different. And so that's a good start. Now you know more about vitamin D and what I recommend. If you would like to get a good quality pharmaceutical grade vitamin D, check out my website, drjuliemclaughlin.com/supplements, and you'll find out. If you want to get your vitamin D checked or any other lab test, just send me a message and I'll be happy to set you up with an appointment and we can get started. That's it for today, and I look forward to seeing you soon. Bye-bye.